think a lot of folks in EMS and the hospital may not be as familiar with doula scope, and they can be such a crucial component of helping minimize trauma to our patients that are transferring when that's not part of their plan for their birth. So Emily, I'd love to kick it over to you to talk about doulas and what it may look like to engage doulas in the transfer process.
Sure. In the last minute here, I'll just really emphasize that, involving, getting doulas and EMS together in a drill is so important. I mean, there's a real chance that the transferring patient from a community birth situation will have a doula. So, including them in drills allows for practicing how the care providers will interact with the doula. The care providers, EMS, the midwives, they're going to be probably moving quickly, preparing, administering medications, working in the moment. And the doulas can be there to help keep the family calm, keep the family informed. And the clinicians can think about how they can use the doulas maybe in a way that could delay or prevent that delay in the transfer. Can the doulas be physically getting the patient's documents and bags together? Can the doula be holding open doors? Should the doula ride in the ambulance with the patient when they transfer? Or I was at a postpartum hemorrhage transfer from a birth center, and EMS came in and said, well, the baby is no longer our patient, so we're taking the mom, but then I stayed with the dad and the baby during the transfer. So really practicing what that will look like for that transfer process, how the doula can be involved, since they will likely be present, and really including doulas in the debrief sessions. I think it was Julie, someone who said those debrief sessions are so important, and doulas really have a unique perspective that they can bring to those debriefs and improve the process.
As we've done with all of these, we can continue on for days and days to have these discussions, but we also want to talk about the importance of doulas and how many folks choosing to have birth in the community often do have doulas and other support people with them, and that having a doula can be such an important piece of a transfer experience, and that in the hospital setting, whether or not doulas are allowed to be there in triage or in the OR or different places in the hospital, can really play a big role in the patient experience and even the outcomes. So Emily, we want to once again turn it over to you in the last moments of our session to talk about the role of the doula and how to engage doulas in the transfer process.
Absolutely. Thanks, Jen. So I really think that an important role that doulas play in birth, but also throughout the transfer process, is providing that psychosocial support when everyone else is really trying to provide that clinical support, maybe the medical, the logistical goings-on that are happening. The doula can be there for the birthing person, for the partner, for the family members, and really be that emotional support, that informational support to help them feel calm and well-informed and involved in that shared decision-making process. I think that's important at every step of the way, but in particular, when you get to the hospital, they can really help bring maybe a transfer birth plan that they have worked on with the doula, with the patient, or just facilitate those conversations, or keep in mind that the doula may potentially be the only support person that a patient has if they're not coming with a partner or a mother or family member. The doula is that one support person that can really provide a lot of psychosocial support for the patient. And involving doulas in drills really helps everyone just gain that much needed muscle memory, that knowledge, that enhanced communication, and that relationship building. So when an instance does occur, everyone is comfortable with what the doula's role is. The doula is comfortable with what to help prepare their patient to expect, and really help reduce any delays or issues with that delay process on that end too.
So even if you have not been part of a drill, you're all very much welcome to come to this session where we will be doing our signature community debrief on, the drills that did happen during this cycle, but also talking about some quality improvement tools that can be utilized at any point in this relationship building process to really test your transfers and continue to improve safety and improve outcomes. And we'll be sharing more during that session.